So let's talk a little bit about initial contracting versus renegotiations. There are always issues with trying to negotiate an initial contract. One, it's whether the payer will even allow you to participate, whether they will provide you the contract in advance, and ensuring that you've got all the fee schedules. Never sign a contract without every fee schedule that's tied to that contract. Otherwise, you have no idea what you're going to get paid. Your billing people or billing vendor will never know whether you're getting paid appropriately or not, and that doesn't allow you to hold the payer accountable. Information is power, so you need that contract so that you know exactly what your terms are and what your reimbursement will be. Right now, ask yourself, do you know what your costs are to operate your healthcare business? Do you know on a daily basis how much it costs you in expenses to keep your doors open? Do you have an idea on what your reimbursement should be in order for you to make a reasonable and fair profit? Do you know what your value proposition is to the carrier? Why should they allow you to stay in network or to become a network participating provider if they don't know what you're going to do for their members and how you're going to treat them? What do you know about the health plan and its strategic plan for the community? Every insurance and health plan, every insurance company and health plan have a strategic plan. Do you? What do you know about your competition and how you compare to them? If you just open up your doors, you operate every day, and you don't know what your competition is doing, chances are your competition is going to beat you to the punch, and you may end up not being in business down the road. So that's something to consider, that you need to know what's going on. What is the possible leverage that you have as a startup in order to negotiate contracts or to even get in network? What sets you apart? When you renegotiate, you have much more of this you could answer if you paid attention over the first few years of your contract. So for instance, when you first start up and you contract with a payer, you don't know a lot of what they're going to be doing, meaning, are they going to require a lot of utilization reviews? Are they going to reject or deny a lot of your claims, stating that it's not medically necessary? Are they going to require a ton of prior authorizations? Medicare Advantage plans are known for that. Hence the reason why Medicare Advantage plans are not Medicare, even though all their advertising will tell you they are. So if the health plan is in its early stages of developing their network, then you're going to have a better chance of getting in network, especially in those states where, states will renegotiate their Medicaid managed care plans, or even Medicare will allow certain payers to cover Medicare Advantage in certain regions or certain states. And all of that gets rebid every year or every couple of years, depending on the contract with either Medicare or the state Medicaid program. And then on top of that, you also have carriers that get licensed in each state that they operate in, and they could lose that business. Good examples are Friday Health Plan and Bright Health. Both of them have been tossed out of states left and right because they weren't operating correctly, they aren't compliant with federal laws, and they just don't do the job properly. So most payers don't know what you do, who you are, or how you will perform based on their expectations and requirements compared to other practices and providers that are already in the network, and they are already a proven entity. So when you're looking to contract with a payer, what is it that you're going to be able to communicate to them so that they understand who you are, what you're going to do, how you will perform, and how you're going to benefit their members? Payers want the following, and you need to understand this from the start, because this is going to help you when you initiate contracts and when you renegotiate contracts, and it's going to help you understand what the payers want. Now, I realize payers are a necessary evil in healthcare. The issue is that payers, as I said earlier, they hold the pile of gold. So they have their own rules and requirements of their network participating providers. So here are 5 areas that every payer is looking for in a good partner provider. 1, a partner to lower the cost of healthcare expense. Now you're thinking, well, how the heck are we going to lower healthcare costs? Well, if you're a primary care provider, you're going to refer patients out to specialists and ancillary services. And are you going to refer those patients out to providers or practices or other ancillary services and organizations that are not in network with the patient's health plan? If you refer people out to these that are out of network, you are costing the insurance company and the patient more money. You are increasing the cost of healthcare. So you want to look at your specialty services you're referring patients to, ancillary services. If you're going to perform, let's say you're a surgeon or some other type of specialist that requires the need to provide services in a facility. Let's say a surgery center versus an OR at a hospital or health system. You're better off performing those procedures in an ASC versus a health system-owned hospital because they're going to charge a much higher facility fee, and that's going to increase the cost of the care the patient is receiving. It will either increase the cost out of pocket, or it's going to increase the cost charged to the insurance company and to the patient. So that is a really big area where you have an effect on the cost of healthcare. The next item is patient access, which is not just about how many hours you're available to the patient. What about communicating with them through a patient portal? Do you provide that so it's easier for the patient to request records or even script refills versus calling your landline, having your phones ring off the hook, and tying up all your staff to answer phones? It's much easier if you have them utilize a patient portal and guarantee them that when they utilize the portal, you'll get back to them in a timely manner, like within 24 hours. Versus if you're on the phone, now you've got phones ringing off the hook, you need more people to answer those phones when 1 or 2 people could literally monitor a patient portal and answer all the questions that the patient needs. What about patient satisfaction? Well, let me add a little more on the patient access. You could be communicating via encrypted text. Millennials love that nowadays, and those are our patients of the future. You can text people when you have an open slot in your schedule and get somebody in to fill it in right away. What about communicating via encrypted email? There are many ways to communicate and provide patient access that provides much better access than your competition. The third item is patient satisfaction. Whether you realize it or not, all of your patients are surveyed by most payers all the time. The payer knows when the patient had a visit. You submitted a claim. That lets them know that that patient visited you. Somebody will be following up with that patient to determine how was the care, how was the follow-up, how was the check-in, did your tableside or bedside manner equate to what the patient was expecting? Are they satisfied? If you aren't doing patient surveys, then you have no idea how your patients feel. And you don't know what the payer knows. The key to all of this is knowing what the payer knows, because the payer's never going to tell you. Unless, of course, they get a complaint filed, then they will contact you and you're already behind the 8 ball. The fourth area of concern is quality of care. Are you participating in quality metrics or quality programs that each payer no doubt has? Are you participating in Medicare's QPP program? Are you participating in an ACO or any risk-based programs? What are you doing to improve the quality of care with your patients? as well as the quality of care from the perspective of the insurer. Now, again, I'm not suggesting that we jump through all these hoops for the payers, but if you want to be participating with that payer or any payer, you've got to follow some of their rules. Last but not least, how are your outcomes with your patients? Do you know? The payer definitely knows, and they can compare every provider with everyone in their network and determine who are their best providers and who aren't. Payers have no problem paying more money to providers and practices and organizations that work on a win-win situation with them. The goal here is to have a win-win situation. Whenever you're dealing with negotiations, if anybody is slighted in the least, it is not going to work out.